takes 2.6 hours for low emergency patients to be seen in an emergency room in Ontario. But is it really necessary to see an ER doctor for some back pain? And how does your doctor assess an ankle sprain over Zoom? Should you maybe just call the physiotherapist? We're back talking with Neela Mahavatane, our senior physiotherapist at Bodyworks Physiotherapy. Neelu, when do you need to see a doctor before you see a physio?
Megan, that's a really good question. It really depends on the type of injury. If you have fallen down the stairs and are having a lot of difficulty walking on your ankle and it's really, really sore, that may be a time where you need to go to the emergency room just to rule out a fracture. However, if we're talking about ankle sprains again and you're on the soccer field, you roll your ankle, but you can still walk on it. There will be a bit of swelling. You can call your physio for an appointment the same day or the next day to get treatment started. Because the sooner you can start your treatment, the sooner you'll be on your way to recovery. But there are other times where you should be seeing your doctor. If you start having blurred vision, if you're having trouble breathing, if you're getting any altered sensations into your arms or slurred speech, those are situations where you'd want to go see your doctor if you've fallen down the stairs. Other situations where you'd want to see your doctor is if you do suspect a fracture, or if you are in a situation where if you've been in a car accident, for instance, and you've lost consciousness, you'd want to be assessed first.
Are there some instances with injuries to the torso where it can be a little bit dicey about whether to see a physio or a doctor first?
So if you're experiencing back pain that is sudden, or you have numbness in the saddle region, that's the area between the legs into the groin area, or you start losing control of your bowel and bladder functions, those are situations where you would want to see your doctor first. However, if you do have back pain with some numbness or tingling in your legs, you can go see your physio, where they'll do an assessment. And if they determine everything, if they've ruled out their red flags, which we'll do during the assessment, and it's safe to proceed, then they can begin treatment. However, if during the assessment things don't seem to be going according to the way the assessment should, then they will refer you back to your doctor or to the hospital.
So red flags aside, are there pros to seeing a physio first instead of going to the doctor?
Well, definitely. The sooner you can get in to see a physio and get your treatment started, you're going to be dealing with your pain immediately, swelling. We can work on range of motion and get you started on a strengthening program. So then that will help you on your way to recovery and get you back to what you want to be doing.
Are there situations perhaps where you send a patient back to a doctor, not because you think there's some more severe thing going on or that they need to see a doctor instead of physio? Are there situations where they need to see you, but there's still reason to go back to their doctor?
They can always follow up with their doctor. Sometimes we'll start with the treatments, but maybe we may want to get further imaging to help with our treatment, to rule out possible tears, if the treatment's going a little bit slower than expected, or if, it's pretty much just to rule out anything that may not be going according to plan.
So are there any scenarios when you absolutely cannot treat a patient before they've seen a doctor?
Definitely there is. And even if the patient comes into the clinic, so supposing there is a patient who's just had a knee operation and they come in with excruciating pain in their calf, that's definitely a point where we would refer them back to the hospital to get an ultrasound done, just to rule out any blood clots post surgery. So there are situations where during the assessment, as we go through the questions and the history, those are questions that'll be in the back of our mind, ruling it out to make sure that as we proceed with the assessment and treatment, the patient is safe.
Okay. So, Neela, with the information you've given us today, what's the next step for anyone with an urgent issue that needs to get addressed by an excellent family physiotherapist such as yourself?
Well, you can always give us a call at 1-866-7-PHYSIO or check out our website at www.bodyworksphysio.ca.
Awesome. Thank you so much, Neelu.
You're quite welcome.